Okay, there we go. It should be recording.
Okay, thank you.
Okay.
All right. Hello, everyone. Welcome to the ACRL Health Sciences Interest Group Friday Forum. Today, we are welcoming Julie Chavo, Assistant Director for Dental Services and Associate Librarian from Louisiana State University Health Sciences Center, presenting on bringing health literacy to dental students. So thank you, Julie. I am going to let you take over.
Okay, wonderful. Thank you, Jules. Thank you guys for having me here today. It is great to talk to you all. Um, so, um, so what I'm here to talk about today is bringing health literacy to dental students. A little bit of an introduction here. As Jules said, I'm Julie Schiavo, and I'm at Louisiana State University Health Sciences Center. I've been here for a while. I actually started working here in January of the year 2000, which makes it really easy to remember how long I've been here. Um, the LSU Health New Orleans, we have six schools: medicine, graduate studies, dentistry, nursing, allied health, and public health. We have two libraries. The East Shade Library is the main library that is on the main campus, and then we have a dental library. The dental campus is about 5 or 6 miles away from the main library. Well, the whole campus is about 5 or 6 miles away from the main campus. So we have our own library. We're one of the few uh, dental dedicated libraries left in the US. And it's really great because we can focus on just our dental students. Um, we have about 415 students. That includes the programs in dentistry, dental hygiene, all the dental residents, dental lab tech, and we have 90 full-time faculty members. I teach this class, the health literacy, uh, why it's more about more than just the ability to read, to the second year dental students. And I'll tell you a little bit more about that also. And a little bit about me. I won't bore you guys with that, but I've been a librarian since 1996. And I actually just recently got my EDD. Um, and, as I said before, I've been working at LSU since dinosaurs ruled the earth. Okay. So what I try to do in this class is I use a lot of things from adult learning theory. I really feel like our students are are adults and they do learn differently. So I try to keep it in a way that they can relate to a little bit better than just, hey, you need to know this. Um, so these are the six principles of Knowles's theory of andragogy, his theory of adult learning theory. He's not the only person that studied adult learning theory, but he's probably one of the most influential. And he feels like adults, or he felt like adults think, act, and process information differently. So that makes sense that they would learn differently also. Um, so he feels that adults, let's see, next page, there we go, that adults are very self-directed and independent. They use their own experiences to define themselves and use their own experiences to relate to the rest of the world. And if you can get what they learn, what you're trying to teach them to relate to their own experiences, they'll learn it easier. The adults show a readiness to learn. They're not going to learn until they're ready, until they want to. They want to learn. The are the students in the health sciences or students in college. They're there because they want to. There's no requirement that they have to be in higher education in some sort. So they are there for some reason, for they do have a reason to be there. They approach learning as problem solvers. They want to know the underlying reason why they need to know something and how it would benefit them. I think that is a big thing in teaching adults is they want to know why. Um, and I think this concept works both with teaching dental students about health literacy and it works with teaching patients about their health. They really want to know why, and if you tell them why, it will help them actually, do what you're asking them to do. And then the last thing that they talk about in adult learning theory is intrinsic motivation, that our adults are motivated more by personal internal drivers than just, I need to learn this. I have to be in school and I have to learn this. They are there because they want to. So, how do health literacy and adult learning theory work together? Well, they actually work together pretty well. Uh, so, when I teach this class, I focus on four concepts mostly in the class: the role of experience, readiness to learn, orientation to learning, and need to know. Um, the role of experience, the students in the class, I have often had dental students tell me that they don't know anybody who has trouble learning, and they don't, excuse me, let me re-say that. They don't know anyone who has trouble reading. They don't understand how anyone could possibly make it in life not being able to read. Well, the truth is, statistically, they probably do. They probably do know someone who has, you know, has problems being functionally reading, but they they're very good at hiding it, and so they just don't realize it. Um, I tell a lot of stories in the class. I tell stories from my life and I tell stories from things that I've experienced in my years working at the dental school to try to bring the concepts down into what they do in their experience. Their readiness to learn, they're there because they want to be dentists. They want to be the best clinicians as possible. And I try to focus the class on this will help you relate to your patients. This will help you teach your patients and be the best clinician as possible. Um, Orientation to learning. For this, I try to express to the students that literacy and health literacy is a problem. It is a problem in the United States. It's a problem all over the world. And this is something that you can do as a clinician to help solve it. Um, Also, need to know. Why do you need to know this? Well, this is something that you can do. This is something you can use in the clinic tomorrow when you see your first patients. This is something that you can put into practice. So, uh, I was going to start and go into the course, and I'll kind of like jump in and out of the course into what is involved in the course, the class, um, and how I try to present it and why I do it in this way. As I said before, this class is part of the professional development two course. That course is it's described in the student handbook as a health communications course, presenting the students with basic skills needed to communicate with patients at varying levels of literacy. It presents the basics of communication, leadership, teams, conflict resolution, oral health literacy, and dealing with special needs patients. And they are presented to students to aid them in the delivery of comprehensive care to their patients. So this is towards the beginning of their second year of dental school. So this is right at the very beginning of when they're beginning to see patients. They're not doing any serious dental procedures, just kind of I think they're doing cleanings, perhaps, or maybe they're taking X-rays. They're just starting to have contact with patients. So this is when this professional development course is in their curriculum, and this is when I get to talk to them. Okay. So the objectives in this class, we talk about what is literacy, what is health literacy, who has low health literacy skills, what are the effects of low health literacy, how can you recognize low health literacy, and how can you address low health literacy chair side. So what is literacy? So why do we start with literacy? Well, because sometimes the problem isn't just health literacy. If someone has low literacy levels to start with, they're going into the health system with a disadvantage. And people who have literacy problems are very ingenious at hiding it. They need to function on a daily basis, and they come up with some very ingenious ways to make it so that they can function in society. One of my first stories that I tell the students, my grandfather, I discovered as an adult, was functionally illiterate. I did not realize it growing up. He would ask me to read things for him, and he would always praise me as as being so proud of how smart his granddaughter was because she could read all of these things. And I didn't realize that I was reading it because he couldn't. Now, money, he knew money. Nobody was going to take him for money. But when it came to actually reading things, he had a real problem with it. And I didn't realize it because he was that good at hiding it in his everyday life. And hopefully, after this course, you can stop and think, is there anybody in my life that might be doing that? So, what is literacy? Um, Full disclosure here. I thought I'd have a little fun. So I went into Google Gemini and I typed in what is literacy. And this is the definition that it gave me, which I thought was pretty good. The ability to read and write, along with the skills to understand, interpret, and communicate effectively in a variety of forms, including written and spoken language, digital media, and other forms of expression. Um, yeah, I was kind of impressed with that definition. It also linked to the National Assessment of Adult Literacy as the source of that definition. I'm not sure if that is the source of that definition, but I think it might be, it might be in there somewhere. So, yeah, so I would say it was a win for AI, but yeah, who knows? So, when we talk about literacy, let's talk about literacy in America. Um, so, this is an old study. And there really hasn't been another study like it since 2003, which is a shame. I wish they would do another one. I think we all do. Um, but it is the National Assessment of Adult Literacy. It was conducted in 2003, and it was a very large assessment of adult literacy. That's the link to it. If you've never seen it before, please go to it and dig around. There is so much information on that site. I think the important thing to remember in this is that it measured a person's literacy level in English only. Um, if it were to have taken into consideration other languages, people who are more comfortable speaking other languages, I think the results would have been very differently. But it did only English. It also did a prison component, which is very frightening. I've got some statistics for the prison component also. So it measured three types of literacy. It did prose, document, and quantitative literacy. Prose is search, comprehend, and use information in continuous text. So that's reading a brochure, newspaper, a book, or a magazine. Uh, it did measure document literacy, which is non-continuous text in various formats. So that could be anything from a nutrition label, a pay stub, a prescription bottle, an appointment slip, something like that. And then finally, quantitative literacy, which would be the ability to identify and perform computations using numbers embedded in print, like a deposit slip or a dosage chart. And to prove exactly how outdated this is, one of the questions on there was actually writing out a check, which I did about a month ago, and I really had to stop and think about it. I was like, when was the last time I did this? Why can't people just take Venmo? Uh, okay, so this is an example of a question from prose literacy. The question is refer to the following article and underline how many times has Susan Butcher won the Iditarod? And so the person would read the whole article. It's about 3 pages, the whole article. Uh, I'm sorry, 3 paragraphs. It's not 3 pages. Um, and you would underline. It's actually right in there. How many times racks up her fourth victory in the past 5 years? So then we have document literacy, which for this one, it is refer to the following table and underline the statement for which the agreement is the same for the population of both parents and teachers. So that would be this statement up at the top. The first statement, our school it does a good job of encouraging parental involvement because both of these are 77, so they both agree. And then quantitative literacy, this is refer to the medicine label and answer the following question. The patient forgot to take his medicine before lunch at 12 noon. So what is the earliest time he can take it in the afternoon? Uh, so based on take one tablet on an empty stomach 1 hour before a meal or 2 to 3 hours after a meal, unless otherwise directed by a doctor. Okay. So, based on these questions, the assessment classified people at different levels. Below basic was people who could perform no more than the most simple and concrete literacy skills. Basic was simple and everyday activities. Intermediate were more challenging activities, and proficient were complex. Let me give you a few examples for that. Proficient, um, comparing the viewpoints of two editorials would be considered proficient. Find the information required to define a medical term by searching a complex document. That would be considered proficient. In the intermediate level, identifying a specific location on a map. Let's see, identifying three substances that may interact with an over-the-counter drug to cause a side effect using the over-the-counter drug label. That would be considered an intermediate level task. Um, a basic level task, comparing the ticket prices for two events, or explain why it is difficult for people to know they have a specific chronic medical condition based on the information on a one-page article about the medical condition. Then below basic tasks were things like signing a form, or identifying what is permissible to drink before a medical test based on a short set of instructions. So, what level are most Americans? Let's see. I'm going to launch a quick poll here. Let's see. You all should be seeing the poll. Yes, great. Hey, let's see. I'm going to go ahead and end the poll. There we go. Share the results. Okay. Have Looks like the majority of people had came up with basic, 65%. Let's see. Um, okay, I'm trying to, there we go. Okay, so this was the result. So actually, the majority of Americans did come up as intermediate, which I was surprised also. Uh, but if you consider that below basic and basic probably have trouble on a daily basis functioning in society, that's still almost half there. So 43% of Americans have serious trouble reading on a daily basis. So it is literacy in American adults is an issue. I told you all I had some stats about the prison inmates. 70% of prison inmates fell below basic in the assessment. And 66% of adults over the age of 60 had what they considered inadequate or marginal literacy skills. So, and one other little piece of trivia here, 19% of high school graduates fell in the below basic level. So for the students who are saying that, you know, they don't know anyone who has trouble reading, you know, people who do go through high school and graduate sometimes still have trouble reading. Okay, so national rankings. They went ahead and ranked people nationally. Let's see if you guys could go ahead and try in the chat Uh, what states did you think um, were had the lowest percentages of people lacking basic literacy skills? So that would be the states that read the best. Okay, let's see. What are we getting? Massachusetts, lots of people coming up. Massachusetts, California, Illinois, New York, coastal states. Okay. Um, so according to this, uh, the lowest ones were actually New Hampshire, Minnesota, and North Dakota. Had 6%. Vermont, South Dakota, Nebraska, Wisconsin, Maine, Missouri, and Iowa were at 7%. So those were the best. Massachusetts was right in there. Wait, I've got my full list here. Let's see. I'm not finding it right now. Oh, come on. It's the one of the long ones. Uh, let's see. Okay, according to the NAAL, Massachusetts had 10%. Uh, so let's see. So how about the highest percentage lacking basic literacy skills? And remember when we put when you guess here, remember this is in English only. Go ahead and try in the chat. Anybody want to give it a shot? Give it a shot. Southern states. Yep. So we've got Alabama, Mississippi, Tennessee, West Virginia, Alabama, Mississippi, Texas, California. Yeah, y'all are in the area. Um, yep, the South, West Virginia. Yeah. So actually, the highest percentage was California, and California, New York, and Florida. I really think that is probably, and I'm talking correlations here, but I think it's probably because they have a larger percentage that it does not speak English as the language they speak at home. And I think that probably has a lot to do with their the rates of below basic literacy skills or lacking basic literacy skills. So, so then what I do with the class for the dental students is I go even more local. So Louisiana. I'm not going to ask y'all to guess about Louisiana because you probably don't know the name of too many parishes in Louisiana. That's okay. But Louisiana actually ranked 40th, which I was secretly thrilled about because I kind of expected us to be somewhere, you know, below 45. Um, 16% of the Louisiana population lacks basic literacy skills. The parish with the lowest percentage lacking basic literacy skills is St. Tammany Parish. That is at 8%. And the highest percentage is East Carroll Parish, which is at 29%. Orleans Parish, where we are, is at 18%. The state capital in Baton Rouge, that's East Baton Rouge Parish, and I didn't write that down, and oh shoot, I don't remember. They are somewhere lower than Orleans. It'll come to me later. I'm sorry. It went right out of my head. Um, but I also try to give the students an idea of, your patient base. We are our school is in Southeast Louisiana, so your patient base comes from Southeast Louisiana, and these are the parishes that our patients come from. This is what the average reading level is in these specific parishes. I St. Tammany is in our patient base. It is just right on the other side of the rivers, other side of the lake. Excuse me. It's about 30 minutes away from Orleans Parish. But East Carroll is all the way up. It is the northeastmost parish of Louisiana. So it's right there. It borders Arkansas and Mississippi. Okay, so then we talk about health literacy. Why do we talk about health literacy? Well, it's because potentially harmful mistakes happen when people cannot read or understand written health information. And I want to show you guys a video. And again, this is an old video. Uh, this was it was put out when health literacy was just becoming uh, part of the something to be researched and something to be concerned with. And so it is, so it's a little dated, but it's a fantastic video, and I really want everyone to see that. It's only a few minutes. It will only take a couple of minutes to show. Let's see. Share. Share sound. Okay. Um, are you all
I was sick a lot.
hearing
I was sick a
this
lot because I
video?
probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it.
Yes. Okay,
I just
great.
didn't understand them, and I didn't have the nerve
not
to
too
ask
long.
them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
Okay. Well, I take baby aspirin. That's something new. Cyclosporin, prednisone.
I took one pill, and I didn't even look at the bottle. I figured it was just, a pain-killing pill. And half an hour later, I took another one, and then an hour later, I took another one. I kept taking them. I didn't have no idea how many pills to take. The only thing I know, the doctor told me to take those pills that would stop the pain.
Vitamin D, Nexium, Norvasc, Colestid, Estratest.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Lipitor, Paxil, Darvocet, vitamin E.
If I'm really embarrassed or confused or worried about things around me or worried about my child being all upset, I would not be able to read things I normally would read every day.
You know, some of the words that this angiography and all of that, what is that, several things or one thing, or it's just a language that I'm not familiar with.
If the patient was transferred to that facility and to any and all insurance companies or other third parties paying or obligated to pay, this is not making any sense.
Tums, Tegretol, Tenormin, sodium bicarb, Cardera.
Hi, when I wake up in the morning, I have a small breakfast, and then I take my pills. I usually take 16 every morning. And sometimes it's difficult to, for me to take these pills because if they say one tablet twice daily, I don't know if they're talking take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them in my system.
Take one capsule.
That's right. One capsule.
One capsule. I don't know what this is. That's
Twice.
Twice daily.
Okay. So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
In fact, she ran out of her high blood pressure medicine, so she didn't take it. She didn't call me to tell me to fill it. So finally I found out that she had not been taking it. I said, Mother, you can't do that. You have to keep taking that high blood pressure medicine.
I went to the doctor because my allergy was bothering me. So he prescribed some pills for me. And I went home and I took the second one. I started to cold sweat and my heart started to pumping real fast. So I was scared, so I called my daughter and to tell her what was going on because my daughter, she's a nurse. So she came into the house and she read and she told me the reason it was feeling like that was because the prescription that I took had some antihistamine in it. And that was right, the reason that my heart was going so fast and I was feeling the way I was feeling. And for the simple, it's like this cold medicine here. Cold medicine here, not even with my glasses on, I can read these labels. They're so small print, it's hard for a person to read it.
What do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Okay.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
Being, you know.
Okay. But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you.
Mm.
So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
They're talking about problems.
Mm-hmm.
Can you see what this has?
Once for every 100 to 1,000 doses.
Mm-hmm. Is that helpful?
No.
Okay. What about this?
Once for every 1,750 doses. No, that doesn't even make sense.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize, the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
Well, my adventures with the cough syrup is wanting to know which one is best for me. So when I go to the pharmacist, I have to get advice from the pharmacy of which one it would be appropriate for me to take.
Yeah?
You notice this one says
Yeah?
Tussin cough syrup, and this one is a Tussin CT and a Tussin PE. So when like I said before, I have to go to the pharmacist, tell him what my symptoms are, and he has to say which one is best for me.
My calcium spray, nystatin, Aricept, Lasix, Ambien, Imodium when you need it, and vitamin D. I believe that's it.
Have you seen this guy? You know, the one that keeps telling us to
stop running on the treadmill.
Well, you might want to listen to this.
If you
Hey, sorry about that. Let's get out of that. Okay. Okay. So, honestly, has everybody seen the PowerPoint again? Hope. Uh, um, so watching that video, that lady who had the hysterectomy by accident was the reason why I got so interested in health literacy and why I've kind of dedicated a portion of my career to teaching health literacy. And that is just so frightening. And I'm not sure if that could happen now, because I know they've done a lot of work with that. The last time I went and had surgery, they asked me, I was in the operating room and they asked me, what are you going to have done today? And I had to tell them exactly why I was there. So I'm hoping that that is the case everywhere, and it is not. Things like that don't happen anymore, but it's frightening. So, okay, let's jump back in here. So what about health literacy? Let's talk about health literacy. So there's two types of health literacy: personal health literacy and organizational health literacy. If personal health literacy is how the degree to which a person can find, understand, and use information and services to inform health-related decisions. And organizational health literacy, this is to which the degree to which organizations equitably enable individuals to find, understand, and use information. These are definitions. They come directly from the Department of Health and Human Services Healthy People 2030 initiative. Incidentally, while preparing for this yesterday, I went looking for the National Academy of Medicine's their checklist for a health literate organization. It was a list of, I believe, 7 things that all organizations should do to be a health literate organization, and the PDF is gone. I couldn't find it anywhere. I found other organizations that summarized it, but the actual the actual document is gone now. So why do we talk about health literacy? Well, everybody needs to find, understand, and use information because, everyone has to, everyone has to face situations where they may not be familiar with medical terms or how their bodies work. They may have to interpret statistics. People may be diagnosed with a serious illness and they are scared and confused and they have to make decisions. And sometimes, if you have a health condition, you have very complicated self-care that you must perform, and that requires health literacy. But health literacy is more of a state; it's not a trait. So let's start with personal health literacy. When you're talking about personal health literacy, nearly 9 in 10 adults will struggle with health literacy at some time in their life. Health literacy is situational. As I said before, if you are diagnosed with an illness and you have to make decisions, you are scared, you are stressed, you don't know what's going on, and you have to make these decisions, and it's hard, it's overwhelming. Health information is complex and it can be overwhelming to everybody, even if they do read well. If you don't read well to start off with, you've got the deck stacked against you when you're going into it. Research has shown that people with low incomes or educational levels are more likely to experience limited health literacy skills, but that doesn't mean they're the only ones that have it. Everyone experiences it at some point in their life, or almost everyone experiences it at some point in their life. So what kind of effects can this have on your patients? Well, they tend to have poorer health outcomes, longer hospital stays. They make more emergency room visits, more medical errors. One of the things that is referenced in one of the classic health literacy books is the stories of parents who bring a child to the emergency room. The child has an earache, so the child is prescribed a liquid antibiotic. Well, 2 weeks later, they come back, the child is still sick, in fact, actually sicker. And they realized that the parents had been putting the antibiotic in the child's ear because it's liquid. The pain is in their ear, so they weren't sure exactly how to give it to them. That's how they figured would be the way to give the medication. It's a misunderstanding. They didn't understand. They tend to ask fewer questions because they don't want to appear stupid. They don't want to appear like they don't understand. And the health system is difficult to negotiate for anyone, let alone someone who has trouble reading. So that is something that is very endemic of people who have low health literacy. Okay. They tend to have more trouble filling out patient forms. Someone who hands you a patient information form and they have answered yes to every question all the way down. Or they answered no to every question all the way down, even though you know that that is not the case. They tend to have trouble with discharge information. They tend to have trouble identifying signs. How many people have gotten lost in a hospital? I know I've gotten lost in a hospital. They're confusing. It's part of health. It's part of health literacy. Understanding insurance, understanding consent form. It's all people who have low health literacy will have a much more difficult time doing that. What about oral health literacy? We're talking to dental students. What are they dealing with? Well, people with low oral health literacy, they tend to have a higher number of untreated cavities. They brush their teeth less. They have they tend to have a higher percentage of biofilm. They tend to have more impact of their oral health tends to impact their quality of life more. And also they tend to visit the emergency room for dental care more. They tend to have a higher score on the community periodontal index, which means that they tend to have more plaque. Their gums bleed more often. They tend to have higher scores on the decayed, missing, and filled teeth index. So basically, someone who has lower health literacy also tends to have more missing teeth, decayed teeth, or they tend to have more fillings. They've also shown that if a parent has low health literacy, their child tends to have higher level of cavities. Their child tends to have a lower oral health, and if they have more dental anxiety, their children have more dental anxiety. Okay, so how can you recognize low oral health, low health literacy? We're going to talk about oral health literacy mostly. There are over 100 different validated instruments for health literacy. There was a systematic review done in 2022. It found 162 papers introducing original instruments and 199 papers that were translating instruments. Some of those were general health literacy. Some of them were condition specific. Some of them were population specific. It runs the gambit. You can find just about anything. So for oral health literacy, these are some of the most popular RELs. It has a companion called Realm, and that is it works as a recognition type test, and it focuses on pronunciation. And the TOEFL, which is the test of functional health literacy in dentistry. Those are two of the earliest ones. There are some newer ones like health literacy and dentistry scale. That's one of the newer ones, and the oral health literacy profile that one just recently came out also. I'll show you this one. This is the RELD 99, and probably have to take this down before I actually post this PowerPoint because it's this is a slide from their test, but it is the participant is given a laminated card. It lists these words, and they're asked to pronounce the words, one after another. And the theory is if they pronounce it correctly, they will have had some experience with the word and they'll understand what it means. There are some problems here. Um, you know, Anybody have any idea about some problems with this? If you want to throw it in the chat. Um, I think it's a pretty good test, but I figure I can probably make it to about 95 after working at the dental school for 25 years. 96, just that word defeats me every time I try. Um, yeah, you can have an understanding of a word without having to pronounce it correct. My thought with this is if English isn't your first language and the person scoring the test could start, considering that you're mispronouncing things very, very early in your test. Um, I know some dental faculty who would probably not do so well if that was the case. So let's see. The other test that I wanted to show y'all, the TOEFL, it's a label on a toothpaste tube, and the people were given that, and then they were asked questions based on the label, like, should you brush your teeth after breakfast? And should a 1.5-year-old child use this toothpaste? Okay. So, our clinic, in 2012, we did a quick study. This was actually one of the first studies that I participated in. And it was just a really quick study um, to see if we could get an idea about what our patients' health literacy level was. So we used the questionnaire. It was developed by Doctors Chu, Bradley, and Boyko in 2004. And we pulled the 3 questions that had the highest scores on them for likelihood of prediction of literacy level. And with that, we determined that at least 15% of our patient population probably had some health literacy problems when they were entering into the student dental clinic. Okay, so another quick poll. I know I am running out of time and I'm so sorry. Let's see. Let's do another quick poll. What do y'all think? Formal assessment of literacy in a clinical setting. Do you think it's a good idea or a bad idea? Let's give it a few more seconds. Okay. So let's and share the results. So 75% said good idea, 25 said a bad idea. Okay. Stop sharing, close that, and so if you consider a good idea, you can customize your teaching strategy based on how people or score on their test. But thinking about, is it a bad idea? Well, stigmatization, fear, labeling. I'm just going to skip right over that word. Um, you know, there's a chance that people won't respond well to a literacy screening. So current evidence does not suggest a formal literacy screening in a clinical setting as a regular practice. And one of the things they found when they were doing this is that many patients will decline literacy assessments, especially older patients. They don't want to deal with a literacy a literacy test. They're in there to see a doctor. They don't feel well, or if they're in there to see a dentist, they aren't feeling well. They don't want someone to ask them how they read. So if that's the case, then informal assessments would probably work best. So this is when I start telling the students, this is the kind of thing you can do when you are talking to your patients the next day. Remember that people with low health literacy are more likely to miss appointments. They're more likely to not to complete their registration forms or do it or or turn in incomplete registration forms. They may not be able to give the name of their medication or their purpose. They may not be able to give you a good medical history. They may not be able to follow through on their tests. They may look at the pills instead of the name that is on the pill bottle. If you noticed from that video, one of those ladies actually opened it up and she put it into her hand and looked at it and said, "Oh, this is my blood pressure medicine," and and that's how she recognized it. Well, that's a problem, especially since if your pharmacy gets it from a generic and the shape and the color and everything changes, then you don't know what you're taking. Okay. So you can learn quite a bit about your patient from being friendly and professional. Look at your patient, listen to what they say and what they don't say, and then chat with them. So look at them. They may identify their medication by looking at the pill rather than reading the label. I also warn them that eventually you're going to get somebody who's going to bring them a Ziploc bag full of pills, not bottles of pills, just pills, and show them that this is what they take in a day. So be prepared. If you give them something to read, watch them read. If you watch somebody read, their eyes read in chunks. You can kind of follow that they are reading. If somebody is just pretending like they're reading, their eyes will probably wander all over. They're not actually taking the time to process it. They may hold it really close to their face, or they may use a finger to keep track of words. That will give you an idea of, hey, maybe they're having a little bit of trouble with this. They may show a lack of interest in written material. Quick story. I was in a doctor's office once and they asked someone to fill out a medical history. He asked them, "Look, I don't have my glasses. Can you do this for me?" And the girl said, "No, you have to fill this out." And he went and sat down. And a few minutes later, he came back and he says, look, I can't fill this out right now. Could you help me with this? And she says, no, you have to fill it out. And he goes and sits down and comes back a couple of minutes later, and he slams the board down and he says, I can't read. And then he leaves. Well, he was there for a reason, but he left. So what happened? So he's gone. Nobody's treating him now. That is a problem. If someone shows no interest in the written materials, there's probably a reason. Okay. Things like, I forgot my glasses. My eyes are tired. Could you read this? I'll take this home and read it later. Uh, you know, could you help me? Could you help me with reading this? Chat with them. How confident are you in filling out medical forms by yourself? That one question was shown to be one of the best predictors of health literacy. Just the answer to that one question. So that is a good one to ask people. How confident are you when you fill this out? And there's also, have you read any good books lately? Just to get an idea, do they read? Okay, how can you address low health literacy? Well, it's a factor that you can change, that you as a health professional can change. You can, by communicating clearly, you can help people understand. And if you help people understand, they will trust you. Don't use jargon. Jargon is in and of itself an act of exclusion. People don't understand what the jargon is, and it sets up a brick wall between you. Right when I first started working here at the dental library, I was working and I heard one of the dental students on the phone, and he was talking to a patient, and he says, I need to get you in for your operative appointment. And then I don't hear anything for a second. And then he says, no, we need to do your fillings. We're not going to operate on you. We just need to do a filling. Well, operative appointment is what the dental students call your fillings. But your patient wouldn't know that. So remember that health literacy is a state, not a trait. When you are stressed, when there are language barriers, that's going to be a real problem, and it is going to set up a barrier. And I'm sorry, y'all, I know I am going over and I need to get this done. I'm going to hurry. So be purposeful in your communication. Remember that less than half of the information is retained. So focus on just a few points, what the patient needs to know rather than what is nice to know. You can cover what is nice to know in later appointments. What they need to know, what should be covered right away. Don't use jargon, use plain language. Words mean different things to different people. So instead of using bruxism, use grinding your teeth. Instead of using halitosis, use bad breath. Things like that. Give the reasons why. As I said before, adults want to know why they need to know something. Follow these directions when you brush your teeth so you can keep your mouth healthy. Talk slowly and allow time for questions. If you ask someone, do you understand, you are going to get the answer yes. Don't do that. Try, what questions do you have? It's a much better way to get a a truthful answer. Okay. Draw pictures. Pictures will come back to you. I had a dental student once tell me that 3 years after he saw a patient, the patient brought a picture of that he drew for them, explaining a treatment, and brought it back to them and said, "Okay, we did this and this, and can you show me what's going on now?" So pictures will come back. Draw pictures and explain things, demonstrate things, and slow down. Anticipate misunderstanding. So confirm understanding. The teach back method, that's a great method. There are plenty of YouTube videos. I'm not going to get into it too much right now, but it's a great method to ensure that your patient understands what you're trying to teach them. So, what's really important is that you make your office a judgment-free zone. What questions do you have? A lot of people have trouble understanding this. How can I help you? Make sure they know you want to help them. If you provide written communication, make sure it's accurate and accessible. Make sure it's written at about a fifth to eighth grade level. It can be written that way. It's not dumbing it down. It can be done. You just have to you just have to work at it. Provide things with pictures that show your patient base, and also make sure your pictures are do relate to what you're trying to say. Don't just throw pictures in that don't relate to what you have to say. A few things that can help the Agency for Healthcare Research and Quality's Universal Precautions Toolkit. That is great. It is available for free. There's a link in the references that can help with writing or with just writing and making an office or a practice judgment free. Also, Ask Me 3. This is a wonderful office philosophy. It is where you make your office open, understanding, and you make sure that every patient knows that you want to answer these questions before they leave. You want them to know, what is their main problem, what do I need to do, and why is it important? Make sure that those questions are answered before anyone leaves. And again, the link is in the references. So as clinicians, it doesn't matter what we say. What matters is if our patients understand, because if they don't understand, it will be the same as if we didn't treat them. So I got lots of references here. Thank you. I'm going to go ahead and stop the recording, and I will stop the sharing. Let's see.